Welcome back to the American College Surgeons Bulletin Brief from the Frontline Surgeons' Voices. With me today are two surgeons who've been attending the Clinical Congress for many years, and we're going to get their perspective. Firstly, my old mentor, Dr. Stanley Goldberg, Clinical Professor of Surgery in the Division of Colorectal Surgery at the University of Minnesota, and secondly, Dr. Richard J. Field, who is a clinical instructor at Tulane University. Welcome, gentlemen.
Thank you.
Thank you.
Great to have you. Let's start with you, Dr. Fields, and just ask, how long have you been a fellow and how frequently have you been attending the annual Clinical Congress?
I finished my surgery training in '84, a orthopedic traumatic fellowship in '85. So I guess with that year lag, I think '85 is when I joined the college. I don't have my diploma on the wall because I'm in a new office. So I was not able to cheat and check that date, but I think '85.
85. And have you been a regular attendee at the annual Clinical Congress?
I have missed, I think, maybe only one meeting, and that was because of birth of a child. So I think I get a bye on that one.
Absolutely. Did you attend last year's virtual Clinical Congress?
Yeah, and I would like to extend my thanks to Dr. Hoyt and the Board of Regents for setting that up. I got more CMEs last year than I have ever gotten before because of the extended period of time that I could watch it. And I very much enjoy that and looking forward to Dr. Turner's format in this year's meeting.
Well, fantastic. And Dr. Goldberg, when did you become a fellow?
I attended my first meeting in 1958 in Atlantic City. And I remember driving out there with Dr. Lillahai and Dr. Christian Bernard and Dr. Lloyd McLean from Canada. Anyhow, that was good. But I've gone to every meeting except one, 1963 I missed. I think my associate was ill. I forget the reason, but anyhow, I missed one meeting in '63. Otherwise, I've been to every one.
Well, that's a very, very impressive track record and a very impressive group of travel companions. Driving. And what did you think of the format last year of the virtual annual Clinical Congress?
I thought it was terrific. I mean, I thought the meeting was excellent, and I was able to attend a lot of sessions. And just as Richard said, I could attend more than I usually attend, because usually as you go from one to the other, you meet people and you end up chatting with people, and you miss a presentation that you'd like to attend. So I hope that the college continues with this format.
Yeah, well, the good news is we are indeed continuing, and Henri Ford is the program chair, and Ajit Sachdeva, the head of the Division of Education, have assured us that this year will be even a more robust program. There's some new content being introduced, for example, skills courses, which weren't offered last year, didactic courses weren't offered last year, certain other elements have been reintroduced, and I believe the credits are going to stay online well into 2022. So the same thing that Dr. Fields said about being able to obtain credits. Dr. Fields, have you had a chance to look back at the program for this coming year and see if anything particular appeals to you?
I scanned over it very briefly, and there were numerous topics actually that popped up that looked pretty interesting, as well as some that are out of my scope of practice that I like to kind of be somewhat up to date on, which allows me to do that as well.
How about you, Stan? Did you have a chance to glance at the program and see what's coming?
I certainly have, and I couldn't agree more. I think that, especially in our specialty, I think that they've expanded it beautifully.
Yeah, no, there's a wide expanse of material for everybody. As talking about our specialty in colorectal, Heidi Nelson is, of course, the director of the division or director of the cancer programs within the Division of Research and Optimal Patient Care, is giving the Haran Debkarian lecture. So there's a lot of things for us. There's a lot of things for everybody. Certainly, Dr. Fauci giving the Martin oration. Be a lot of interesting things to hear. Certainly. So if you wanted to tell one of your associates or colleagues who wasn't familiar with the college what to expect, Dr. Fields, what would you tell them? In other words, what's your elevator pitch to somebody who hasn't attended the virtual annual Clinical Congress?
It's a wonderful time to network, which for me as a rural surgeon is critically important. But it also, the scope and the quality of the educational package that's put forward is just wonderful. And you can find anything that you want to expand your knowledge base on. There will be a talk on it and you can go to it. And as my father told me when I went into practice with him in 1985, that there's a couple of meetings that you should never miss. Don't miss your local regional meeting and don't miss the college. And that was his instructions to me. And I'm pretty much follow that to the T with success.
Well, very sage words from your dad. Stanley, what would you tell people?
I couldn't say it any better than Dr. Field. I think he's laid it out beautifully. The college really over the years has provided such a broad scope of of interest that if you can't find something there to interest you, you got a problem.
Well, I don't think any of us will have a problem because I think Dr. Ford and Dr. Sachdeva, the program committee, the staff at the college have put on a fantastic program this year. And I hope the wise words of you two gentlemen have helped convince some people who might not have thought about attending. And of course, as we've heard from both of you, the idea that you can linger over the content, you can actually hear lectures that normally would be in multiple rooms at the same time. You can put them on your playlist and see them whenever you like to do. Just
as Dr. Field said, the problem is you're not meeting people from all over the world that you normally meet at the college meeting. I mean, the college attracting people from all over the world was absolutely marvelous.
Agreed, and hopefully we'll get back to that in 2022. Hopefully we'll
Where will the meeting be in 22?
The 2022 meeting will be in San Diego. So we're looking forward to seeing both of you in a virtual sense in 2021 and shaking hands with you in 2022.
Wonderful.
Thanks both of you for your time. Stay well, stay healthy.
All the best. Thanks for including us.
Thank you.
Thanks.